Hi Ready Set Mums, welcome back. This week we are discussing week 20 of your pregnancy, which is considered halfway of your pregnancy. However, a full-term pregnancy is considered anywhere between 37 and 42 weeks. So you may be halfway, you may be more than halfway, you may be less than halfway. There is no rule of thumb for pregnancy and childbirth, but either way, you are considered halfway through your term of pregnancy. Now, your little baby at the moment, wait for it, here comes the fruit and vegetable analogy, is about the size of a banana. So he or she is about 6.5 inches long and weighs about 10.2 ounces. Your baby is also busy guzzling your amniotic fluid this week. It is drinking it and taking it in quicker and in a greater volume than it has before. It's also very, very busy developing its organs. So major organs, things like its heart chambers, its brain hemispheres, and its kidneys. And it's also developing its sucking reflex, which is actually instinctive. So if you were to have an ultrasound, you would see that if your baby was playing with its face, with its fingers or toes, it would instinctively turn and go and suck its thumb. Now, my second baby, Indiana, most of the ultrasound, she was actually sucking her toes. And I knew my radiographer, and she nicknamed her Fergie, and that was the name of her while she was in my belly. If you haven't read the story, get on Google and read it, and I assure you, you will get an absolute laugh out of that. Now, during week 20, your doctor or midwife will start to measure your fundal or fundal height, and this is a measurement between the tip of your uterus and your pelvis. So they're measuring the length of your belly. Now, your fundal or fundal height should match up with your week of pregnancy plus or minus 2 centimeters. So to take out the confusion, at 20 weeks pregnant, your fundal or fundal measurement should be somewhere between 18 to 22 centimeters. Now at 36 weeks, when I went in for my fundal or fundal height measurement with Ayla, my midwife actually looked at me and exclaimed that my baby had shrunk. Wasn't the case at all. She'd actually just disengaged out of my pelvis, which reduced the length of my tummy. Now you might also notice that your hair and nails are growing faster and getting stronger, and you might also notice that you're getting more hair in places that you haven't had it before. So some common places are around the top of your face here, and you can see mine at the back of my neck. Now for the majority of women, that will fall out. Actually, when I go and get my hair treatment from the ladies here in Bali, they often grab this part of my hair and exclaim and ask me if I'm having a baby or if I've just had one. And I get to say things like, no, it's just that my baby hair never fell out and my feet never went back to their normal size either. All right, some things that might be happening this week for you is that you might see an increase in discharge. This is going to constantly happen over the remainder of your pregnancy. Remember, the reason for this is it's your body's way of cleansing and removing the bad bacteria. Just keep an eye on the color of your discharge, because if it is a little bit smelly or a different color, let your doctor know, because it may be a sign of infection. You might also notice that you have more of an appetite because you have less nausea, plus you're growing a baby and it's growing quicker and quicker and quicker. So stock up with some really good nutrient-rich foods. You might also be getting headaches when you're in confined spaces. So make sure you can get as much fresh air as you can. And heartburn, yep. Your baby's pushing everything up, so your stomach acid can get up here easier. That's the explanation for that. But that pushing may also mean that your baby is crowding your lungs. So you might start to find yourself a little bit breathless, especially if you are active or running or going for a walk. It might take a little bit more time for you to gain your breath back. Now, around 20 weeks, because you are considered halfway, you might start to feel a little bit overwhelmed with everything you have left to do. A little tip to actually trick the overwhelm in your brain is every day, just make a list of 1 or 2 things, no more, that you want to do in relation to preparing for baby, and then do them, and that's it, and get up the next day and do 1 or 2 more. Now, your checklist for this week is 1, let people help you. There is nothing wrong with having someone either side of a pregnant woman grabbing hold of her arms, helping her up out of her chair or at her desk. Completely normal, and it's a much easier way to start getting up now. You might also notice that you are getting uncomfortable and having trouble sleeping. So ask your partner or people around you just to fetch you a pillow and help you to be comfortable. You might also like to consider, if you haven't already, registering or enrolling in childbirth classes. This can also help you determine what you might like for your pregnancy and birthing experience, but it also helps you to understand the different stages that your body goes through childbirth, so you know what to expect, and it isn't such a shock when you get in there. You might also like to inquire about your 24-week appointment and ultrasound. All right, ladies, let us know how you are feeling. Congratulations on reaching halfway. maybe or maybe not. Congratulations either way. We are loving being with you on this journey at Ready Set Mum. As always, keep your comments and your photos and your stories and your questions coming, and we look forward to seeing you next week for your 21-week pregnancy discussion. I'm hiding from my kids, but before you go, do you love this video? And did you want more great pregnancy information delivered directly to you? If so, make sure you just drop by and subscribe to Ready Set Mum using the links below. Good luck.